Good afternoon, everyone. Thanks for joining us today. Welcome to Mary Greeley Primetime Alive presentation, Keeping Your Heart Healthy. I am Danielle Linder, and I'm stepping in today for Vicki Newell, who's the manager of Primetime Alive. As a reminder, if you would like more information about Primetime Alive or how to join, please visit our website, mgmc.org/PTA. Our presenter today is Carrie Adams. Carrie received her diploma in nursing from Mercy College of Health Sciences and her bachelor's degree from the University of Iowa. She is also a certified cardiac rehab professional. Carrie has been at Mary Greeley almost 19 years, 8 of those years in her current position as the clinical manager of cardiac rehabilitation, and the previous 11 years in the cardiac catheterization lab. Please welcome Carrie.
Hello, everyone. It's so nice to see faces. Last year I did this and I talked to a wall, so this was nice. But it is nice to have the online option. I think that's one of the good things that came out of COVID, right? That you've got some flexibility and can see things from home. So, but welcome everyone. Happy Heart Month. May as well talk about our heart health, and I even wore my heart sweater. My Valentine, it's kind of the Valentine's equivalent of a Christmas sweater. So I just want to start out with why is this even important? Why do we talk about heart health? And heart health is your heart is central to overall good health. Everything, your body relies on your heart. If your heart's not healthy, most of the rest of your body's not going to be healthy either. So embracing a healthy lifestyle at any age can prevent heart disease and lower your risk for heart attack or stroke. You're never too old or too young to begin taking care of your heart. I think recently we've talked about it's entered the world of pediatrics as well, and making sure that kids are eating healthy and getting their exercise, and so that we have a healthy heart in the future. This is just some of the topics I'm going to touch on today: exercise, healthy eating, stress and strong emotions, and then there's kind of a collection of other kind of risk factors that enter into the picture. Let's see. I think before Oh, sure. Sorry. Yeah. Oh, I can talk really loud. So yeah, absolutely. I'll get in there a little better. Sorry about that. Yeah. Yes. Okay. So I think most of us know this. We've got the Super Bowl coming up this week, and I think there's a lot of fun associated with that. But that maybe it could be some examples of what not to do. So if some of us might remember the Bears, our super fans from Saturday Night Live, and while they were very funny, maybe not the best examples of heart health. And I think they were continually joking about having another heart attack. And one of them said they had a Polish sausage lodged in the lining of their heart and things like that. So this might be overdoing a little bit, not what we're going for with heart health. I will give them credit for being social and being involved, but the rest of it's maybe not that good for you. So if anybody was able to hear what I talked about last year, I focused on exercise. So this is going to be a little bit of a recap from that. But exercise, of course, I'm cardiac rehab, so that's of course what I do. I tell everybody to exercise, 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 and I think not everybody really understands what is that, and I think people often think that just being busy is considered exercise. But exercise is physical activity that's planned, structured, and repetitive for the purpose of conditioning the body. So exercise consists of 3 different components, with the cardiovascular conditioning, strength and resistance training, and flexibility. Cardiovascular exercise is going to be rhythmic, continuous, and performed with the large muscles of the body. The American Heart Association recommends 150 minutes of moderate exercise per week. Most people divide that up as 30 minutes 5 days a week, but you really can divide that up however you want to. And I do want to see people doing at least 10 minutes continuous of cardiovascular exercise. So not everybody can do 30 minutes continuously. You might need to do 10 minutes and then take a break, or maybe you just don't have time to do a full 30 minutes, or so you're dividing it up a little bit differently, and that's okay. You can do, it's not wrong to do more. You can do more than 150 minutes per week. And if you do a very high intensity exercise, you actually don't have to do quite as much either. You can do less than 150 minutes. But moderate exercise is kind of where most of our exercise routines live. And so you should be able to still talk while you're exercising to qualify as moderate level of exercise. So when you're doing something that's a high intensity, much more, you're using all your wind power to breathe and not talking. So that's kind of where that divider lies as far as what's moderate and what's intense exercise, cardiovascular exercise. Strength and resistance training, I feel like cardiovascular gets all the attention, but strength and resistance are an extremely important part of heart health and physical health and exercise. So strength and resistance are physical exercises that are designed to improve strength and endurance, this at least twice per week. You can do, a lot of people do it every other day, maybe do strength and endurance, or strength and resistance. You can do strength training every day, but you have to use different muscle groups. Those muscle groups need time to recover. So you could do, just working your upper body one day, the next day you can do lower body. But at least twice per week is really what we're shooting for with with strength and resistance training. This helps your bone health. It helps your balance. That strengthening those muscles helps your overall body. It helps your metabolism. Strength training is fantastic. We don't want to leave that part out of your exercise routine. And then I think this one gets skipped the most, flexibility and stretching. It's physical exercise in which a specific muscle or tendon is deliberately flexed or stretched in order to improve the muscle's felt elasticity and achieve comfortable muscle tone. So I think most of us have realized, I feel like it's been coming down on me hard lately that I'm not as stretchy as I used to be. And, just trying to do different twisting activities and different. So I've recently developed a yoga routine to help with that because I have not been doing good with that. But it's important to keep up with that stretching. It's something that's very easy to fit into your day. You can do that first thing in the morning. You can do that still in your pajamas. It doesn't have to be associated with your exercise, with your workout that day. If you're going to the gym or something, you can do it at a different time of day. So you want to do this at least 3 times per week, ideally every day. So if you make that part of your morning routine, like I said, still in your pajamas is just fine, and do some stretching first thing in the morning. It can really help your body function. It also prevents injuries if you can keep your muscles stretched out. So exercise, there's 1,000 reasons people find to not do it. And it's easy to just be busy and consider yourself, I'm busy, I'm active, I don't need to exercise, but you really need to get that exercise component in there. So the first thing I say is find something you enjoy. If you hate riding a bike, you're not going to want to do it. You're not going to stick with it. So find an activity that you like. If you find that stationary equipment boring or it doesn't fit into your life, find a group class that you can do. And if that doesn't work, finding even a sport that you can do. If you can find something, whether that's I was going to say tennis, but what is it called? The pickleball is the hot thing these days. So, but finding some sort of interactive exercise is great also, but finding something that you enjoy. And modify that as needed. And, if you have some sort of an injury, you maybe need to find something else to do, but keep trying is all I say with exercise. Keep trying to find something, try different things, find a way to stick with it and find something that you like. I also say have a backup plan. And so if you're walking outside, is your regular exercise. That's great. And I love the outside activity. I love outside exercise, but we live in Iowa. So walking outside is not always going to be the best option for you. So have a backup plan. If I can't walk outside, I'm going to go walk at the mall. If I can't walk outside, I'm going to use the treadmill. Just always remember that you have something else, kind of have a fail-proof plan for exercise to keep yourself doing it. Schedule it if it's something that's not clicking for you or it keeps kind of falling out of your routine. Try scheduling it, putting even a timer. Say, oh, it's 9:30. It's time for me to exercise. I need to go do this right now. Otherwise, it's so easy to get busy and to let that fall out of your routine. But keep trying. Keep trying. So, of course, healthy eating. We definitely, healthy eating is a huge part of heart health. And honestly, a healthy diet and lifestyle are your best weapons to fighting against cardiovascular disease. I think diet nutrition can get confusing. I think a lot of people hear information in the news or in the public, and it feels like it gets overwhelming, and you're not sure which way to go or what you should eat, what's healthy. Advertising is very confusing. They say things are healthy, but they're really not. So how do you make the best choices? But I really want you to focus on a healthy dietary pattern. Think about eating healthy most of the time. This is how I eat most of the time. So eating a variety of fruits and vegetables, eating whole grains instead of getting the white bread or the white flour. So low-fat dairy products, choosing skim milk instead of higher fat products, skinless poultry and fish, nuts and legumes, and then avoiding those tropical oils or those saturated fats. Fruits and vegetables, you want to just try to keep a variety. I actually kind of like the eat your colors thing, the idea that, try different colors of fruits and vegetables just to make sure that you're getting a variety of it. But if you have favorites, stick with your favorites. And I have on here to try to get 5 to 9 servings of fruits and vegetables per day. That can sound overwhelming. That can sound like, holy cow, that's what else am I going to eat? So keeping in mind serving sizes. So if you have a fresh apple, and we've all seen the ones, they can get pretty big. A half of an apple is a serving of fruit. A half a banana can be one serving of fruit. So, and you think about a cup of raw vegetables is a serving, or a half a cup of cooked vegetables. That doesn't, when you think about what we really put on our plate, that doesn't seem like that much when you think about it in a real serving size. I think that there's a lot of confusion about what type, fresh, frozen, canned, any of them are great. The canned and the frozen, you really do have to be careful about the way they're packaged, of course. Do they have are they packaged with salt, especially canned? Pretty much anything canned comes with salt. And a lot of those frozen ones can have a sauce in with it. So that can really deteriorate the quality of those fruits and vegetables for you. But definitely try to get those in with every meal. Keep trying different varieties of those. Keep trying different ways to cook those. If you think I hate Brussels sprouts, why would I eat those? Try cooking them in a different way. Try roasting them. Roasting vegetables is I'm always telling people to do that. That tastes so much better to do that. And but you can little olive oil, little tiny salt and pepper, and throw that in the oven, and vegetables taste great. So. Again, just like with exercise, keep trying, keep finding ways to eat those healthy vegetables. Get those fruits and vegetables into your routines, into your normal way of eating and cooking. Whole grains. I want the word whole in the package of whatever it is you're eating. So whole wheat, whole oat, corn on that food label. So if it just says that it's wheat bread, it might just be, white flour, but in colored brown, and it's not really a whole grain. So again, advertising can be very tricky as far as the way things are listed. But if you are looking for the word whole on those packages and labels, you're going to be getting a whole grain or healthier food. so you can get the whole wheat pastas, and they taste so much better than they used to. And using brown rice, that type of thing. Avoiding the white things that are the white flour, the white rice. The less processed, the better. So the more whole that grain is, your body has to work harder to break it down. And so it's if it's super refined, that super white flour, it's basically like eating sugar. It just your body doesn't have to do anything to process that. So trying to eat more of the whole grains and whole foods. Lean protein and dairy and low-fat dairy. So choosing poultry and fish without skin. I don't know why you'd eat fish with skin on it, but some people do. But choosing that without the skin and then prepared in healthy food ways. So of course you don't want to then fry it. Have a healthy protein and then deep fat fry it or something like that. Try to avoid adding the saturated or trans fats to that. Red meat is okay in moderation. Just choose lean cuts. And use 3 to 4 ounce servings so that you're not having large amounts of the red meats. Try to eat a variety of fish at least 2 times per week. I think that in Iowa, we're not really good about eating fish. Some people are and are really good about it. I admit it's something that I have to work a little harder to get fish into my normal routine, just because I'm kind of picky about it and can't always get great seafood in the middle of the country anyway. Choosing low-fat milk, low-fat dairy, so that skim or 1% is really the best way to go with the dairy products. And give the plant-based proteins a little love too. So consider having vegetarian meals. Consider having that part of your routine, even if it's that meatless Monday. Throwing that in once a week, where you're intentionally having vegetarian meals and using like beans or legumes as your protein and meals. And there's just lots of great options out there and lots of great recipes that you can find, and you won't miss the meat. So this is a kind of a busy slide here about fats. So I have this categorized: the love it, limit, lose it. So love it is those unsaturated fats. So this is your olive oil, your canola oil, avocado, nuts, flax, even those fatty fish like like salmon, tuna. Those unsaturated fats actually help lower your cholesterol and triglyceride levels, and your body actually does need some essential fats. We just are really good at getting plenty of those, so we typically don't have to cut back or don't have to try too hard to get those. Limit it. It's okay to have a little bit of cheese, a little bit of butter, using it sparingly, a little bit of fat with your meats, but it does raise your bad cholesterol and increases your risk of cardiovascular disease. So I think my patients get tired of me saying moderation, moderation, moderation. I want you to. It's okay to do these things, but do it in moderation. Now, the lose it category is, the fried foods, heavily processed foods, coconut oil. Coconut oil, I feel like, has kind of come into, I've seen it around a lot and included in recipes and put in I think added, people put that as or convincing people it's a healthy food. It's not. It never was. It never is. It's a saturated fat. It would be much better to choose like an olive oil or canola oil if you want like a neutral oil for something. I think it has kind of entered in with it like a vegan type recipes, that kind of thing, putting that and replacing butter with as a fat. But I would much rather people chose the vegetable oils there. Sodium. Sodium is a little bit tricky also. This is kind of a wide range, but I want people to aim for 1,500 to 2,300 milligrams of sodium per day. So 1,500 milligrams is more if you actually have a cardiac diagnosis. 2,300 milligrams is what most people should really shoot for to be on a low sodium diet. really all of us should really try hard to have that lower sodium diet. The amount of salt and sodium in processed food is astounding. And if you really want to check labels on things, anything packaged, boxed, canned, unless it says there's no sodium in it, you can kind of guarantee it's got sodium in it. Anything that's been processed anyway. So it's surprising the things that it's in. Even sweetened things will have salt in them or sodium in them because it's a preservative. And then you can also have two different products, like two different jars of spaghetti sauce that vary a lot with the amount of sodium that are in those. Packaged bread has a lot of salt in it and can vary a lot between brands. So something to just kind of be in tune to and check, and maybe check comparing different brands to help you make a better choice of which one that you want. Sodium is an issue because it can really impact blood pressure. I really encourage people to use things like herbs and spices in their cooking, and just a little sprinkle of salt is not a big deal. It's really it's already in the processed foods that is the biggest culprit. Restaurant foods also tend to have a lot of salt in them. I just this weekend had a very disappointing meal that had very high, it was very, very salty to the point that I couldn't eat it. So if it tastes salty, it is. So you want to just eat a little bit of it, save it for later, or just don't eat it. Because a lot of restaurants, of course, they don't have the nutrition contents listed. You don't always know exactly what's in those meals. So, but just be on the lookout for that. Try to incorporate more herbs, spices, other flavors in your foods than just using salt. I will also say I'm not a fan of new salt or no salt product. It's actually a potassium chloride, and to me it has kind of a strange taste to it. I would prefer people just kind of got away from that salty flavor and used other things to flavor their foods. I would also say salt is salt is salt. So you hear people using sea salt or different kinds of salt. It's still sodium. It's still the same amount of sodium. Some people think they use less when they're using like a sea salt or a bigger grain of salt. And if you do, that's great. That's fine. But it's still salt. Sugar. I think we've always known that sugar's not great for us, but it's also one of those sneaky things that has found its way into a lot of processed and packaged foods, even foods that are you think of as more savory, but there's a lot of sugar in those. And when I talk about sugar, I'm talking about added sugars. There's natural sugars in a lot of foods, like milk, or like lactose or fructose in fruits and vegetables. So limit added sugars to 6 teaspoons for women, and not fair, but 9 teaspoons for men. So that's for men, or for women, that's 25 grams, and men, that's 36 grams. And just to put that into perspective, that just a regular can of soda, 12-ounce can of soda, has 38 grams of sugar. That's it. That's really it for the day. So there's a lot of sugar in especially in processed foods, in processed sweets, prepackaged sweets. So limiting that, and again, it's still sugar is sugar is sugar. Honey is still added sugar. Maple syrup is still added sugar. Molasses, any of those things are still sugar. And sugar is actually one of there's been more research recently that shows that really impacts your triglyceride levels. So it can, even though you don't think of sugar being a culprit there, it does impact your cholesterol. Alcohol. I had to put this in there because I always get a question about that, about alcohol. So currently, the American Heart Association still says that drinking in moderation is acceptable. And moderation is 1 drink per day for women and 2 drinks per day for men. If you don't already drink that much, you don't need to start. There's actually been some more recent research that's saying, yeah, not so fast, maybe not, maybe ease off on the alcohol. So it's still listed as acceptable by American Heart Association, but certainly do that in moderation. And excessive drinking actually contributes to high blood pressure. I wish I wrote the percentage down, but it's a higher percentage than I had expected. It's like 40% of people that have high blood pressure can attribute it to alcohol. It can contribute to cardiomyopathy. That's like the weakened heart muscle, and cardiac arrhythmias. So your heart rate is irregular. But moderation is considered acceptable. So just in summary, that for the diet, avoiding those processed foods, eat more fruits and vegetables. Most of us don't get enough. And just don't keep those unhealthy foods in your house. It's really easy to eat stuff when it's in your cupboard and you're craving a snack. So just try not to have it around your house. Cook from scratch as much as you can, staying away from the processed foods. Minimize eating out at restaurants, or work hard to make good choices when you are at restaurants. Don't drink your calories. The juices, sodas, alcohol, all of that adds a lot of calories to what you're eating. And if you just drink water with your meals, you're going to reduce your intake quite a bit. And then plan ahead with snacks and meals. I think that this is probably the easiest way to stay on top of your healthy eating is to plan ahead. Plan ahead with your snacks. Sometimes you might have to take those with you when you're traveling, when you're going to somebody else's house. If you're going to a holiday party or any social event where you're bringing food, make sure you're bringing something that's healthy that you know is okay, because most of what's there is probably not going to be very healthy. And it's okay to eat those other things in moderation. Like I said, you're eating healthy most of the time, but you don't want to get to a party and find out there's really nothing that you should eat, and then you're going to go home starving. So, but just try to plan ahead with the healthy foods and snacks. Stress and strong emotions is something also that I think gets forgotten when we talk about heart health. Stress can be defined as any type of change that causes physical, emotional, or psychological strain. Stress is your body's response to anything that requires attention or action, and everyone experiences stress to some degree. The way you respond to stress, however, makes a big difference to your overall well-being. So we talk a lot about that it's impossible to say that you're just going to avoid stress. It's impossible. I mean, if you have a death in the family, there's a natural disaster, stressful things happen no matter what you do, completely outside of your control. So you just have to figure out, how am I going to deal with this? How am I going to manage stress? What am I going to do as these things come up? How am I going to get through this time, get through that event? So there's the positive stressors. Stress isn't always just negative. Positive stress can motivate and focuses energy, coping ability. It provides excitement. It's by definition, it's something happy. A wedding, a Christmas thing that is stress, but it can be a happy moment as well, and it can actually improve performance. Physical and psychological. But negative stress, this is what we're really wanting to focus on and work on here, is that when it's negative stress because it feels terrible. You don't feel good. You're feeling distraught. It causes anxiety, can decrease your endurance or performance, and it can lead to physical and psychological deterioration. Again, I have a really busy slide here, but I just want to point out how many things that stress can impact your health, the way different ways that stress can impact your health. Physical signs, emotional signs, mental signs. I can tell you that I've had more than one patient in cardiac rehab that has had a cardiac event, and their only risk factor is stress. It is possible. I mean, it really does impact your heart health, and it's something that you have to think about, you have to manage. I'm not going to go through all of these, but there's such a huge impact on your physical body. So short-term effects of stress, you're having a confrontation. You can experience high blood pressure, muscle tension. Your breathing increases. You can get headaches. Afterwards, that can be very fatiguing, low energy. You can get colds and infections if you're feeling stressed. Not sleeping well. You can get chest pain, chest tightness, rapid heartbeat. It can impact you very quickly. And then long term, if you have stressors that you just have all of the time, things that just don't go away, and this can be family stressors, can be money stressors. Lately, this can be politics that never seem to go away. But there's just these long-term stressors. That's when you don't just have high blood pressure when something stressful is happening. You now have a diagnosis of hypertension if you're feeling stressed all the time. Chronic pain, suppressed immune system, colds and flus, just a general sense of fatigue, and not just, I didn't sleep well last night, I never sleep well, turns into insomnia. It can turn into a diagnosis of depression or anxiety, memory and concentration issues, and then definitely can impact digestive issues and even eating disorders. So managing stress, there's a very wide range of what you can do about it, and for everybody that's a little bit different. So I have suggestions for just, when you have an event that is stressful that's coming up and you're not sure, I'm going to do the best I can. Just using that positive self-talk to get you through something, I'll do the best I can. Then emergency stress stoppers. So this is maybe you're having a confrontation where I'm going to say something I regret if I say it right now. So taking 3 to 5 deep breaths, or it's just I need to not say something. I mean, I think people have been at social events or even family events where those things happen. I just need to keep my mouth shut. But taking 3 to 5 deep breaths really can help settle down your blood pressure, can help you help interrupt that effect of the stressors. Counting to 10 before you speak, and even just walking away. I had a participant, a patient recently told me that he'd had a friend that reminded him his TV had a mute button and an off switch. So it's okay to just turn it off and walk away. Now, there's stressors that you eventually you're going to have to confront them, and that is part of your stress management is dealing with something also. But sometimes when it's that immediate confrontation, it's something that's just upsetting, you kind of have to walk away. So finding things, though, that make you feel good. So this is just even some distraction to get you through stressful times, stressful events. Finding hobbies, and sometimes it's just mindless things will help distract your brain from whatever event is going on. Those are jigsaw puzzles, those sitting there and crocheting, listening to music, reading, any of those things. Just even seeing friends, seeing something else, doing something else that's not involved with that stressor is a big helper. Finding effective relaxation techniques. And once again, I admit I'm always promoting exercise. So that's going to be a huge part of managing stressors. That really helps you burn off that extra energy that's coming from stress. Anything that's like the deep breathing type of exercises is an added benefit when you're talking about managing stress, though, is yoga, tai chi, that kind of thing, where they also focus on your breathing and breathing through those exercises. Meditation, prayer, just deep breathing is also helpful with managing your stress, and healthy eating. And that can be really hard when something's stressful and you just want comfort food. But then you kind of think about, well, when I eat that giant bowl of macaroni and cheese, then I really feel tired afterwards and I feel terrible and I can't deal with what I need to. So it's hard, and it's so, like I said, it's moderation. If you need that one moment where you're going to indulge in something that's maybe not the best, healthiest thing for you to eat, but overall, keep up with those healthy eating habits. Do your best to stay on top of that. Loneliness and social isolation. So this has come up a little bit more recently, has kind of come to the forefront a little more recently. For some reason, this whole pandemic created a little bit of a problem for a lot of us. But there is a difference between social isolation and loneliness. So social isolation is just having few in-person social contacts. Loneliness is when people perceive themselves as isolated, causing them to feel distressed. So you don't necessarily need to be a social butterfly, but if you're feeling like you're isolated or lonely, that's a little bit different. People who are feeling lonely tend to engage in behaviors that are not good for heart health. Smoking actually is there's a very high rate of people who say that they're lonely that are smokers, and unhealthy diet, not getting enough exercise activity. And so that can be something that's really hard to bridge, especially when, we do have this pandemic, and we're kind of getting through that and figuring out how to manage that a little bit more. But a lot of people still are not doing things that they used to do for good reason. But that can feel not great. And so getting creative and finding ways to be involved, be connected, be around the people that you want to be with and talk to, doing your best to that intentional involvement. You don't have to be the life of the party. Sometimes just sitting in the corner and being around people is perfectly fine, and that's okay. And consider getting a pet. There's actually a lot of research that shows people with a pet report a lot less loneliness. It makes a big difference in the way that they feel. And pets aren't for everybody, but sometimes they can help. And maybe if you don't want a pet, you can volunteer at but you still like animals, but you don't want one to live with you. You could always volunteer at the animal shelter. They always like to have helpers. So this is some of those other risk factors that I just wanted to touch on. High blood pressure is a huge part of heart health, and or hypertension is the diagnosis that goes along with high blood pressure. So our goal, and this is from the American Heart Association, across the board, is to be your blood pressure to be under 130/80. Unless you have different instructions from your physician, this is kind of where we're at right now. These recommendations have changed a little bit over the years, but this is where we're at right now. So trying to keep people's blood pressure under 130/80. High blood pressure can increase your risk of heart attack and stroke. It increases your risk for the enlarged heart or heart failure. It can increase risk of kidney disease and kidney failure, and can cause strain and damage in your eyes. So it's not only heart health, but it's important to keep your blood pressure controlled. Make sure that you check it. Again, so we're going to go back to how do I do that? Manage your stress, staying on top of that, figuring out ways to get through stressful events, watching that sodium, and exercise does have a huge impact on your blood pressure, keeping that under good control. Diabetes. So if you have diabetes, do your best to keep that under control. Keep that making sure that you're taking your medicines, checking your blood sugars, and if you do not have diabetes, but maybe you're high risk for that, make sure that or consider there's a diabetes prevention program, and they do have that here at Mary Greeley, and Medicare does cover that. But it's a great year-long program. I think it's a year that they talk to people about ways to help prevent developing diabetes. More recently, some physicians have considered treated diabetes as a heart problem, as another form of heart disease. So diabetes has a strong connection to heart disease and coronary artery disease, and it's try to work hard to make sure that you keep that under good control. But if you do have diabetes, work with your provider. The diabetes educators are amazing, helpful people who do a really great job of optimizing treatment for people who have diabetes. The first thing I ask people when they tell me they have diabetes is, who's your diabetes educator? Who are you going to see? All right, let's set you up then. Because they do a great job of listening. And they help you figure out what works for you, what's going to work best for you, for your lifestyle, with your insurance coverage, all of that. And then they'll communicate that with your doctor. And so they do a really great job with that. So smoking. I hope I don't have any smokers today. It's very bad for you. So I think we've all known for many years that smoking is not good for you. If you do smoke, the absolute best thing you can do for your heart is to quit smoking. If I had to pick one thing, it would be to quit smoking. It's hard though, and I jest here, but if you are a smoker, it's hard to quit. So, or someone you love is a smoker, it's very hard to quit. We know that there's addictive substances there. It's very hard to quit smoking. And this is cigarettes, this is vaping, this is cigars, this is pipes, everything across the board. Stay away from it. If you do smoke and you want to quit, get help to quit. There's lots of great medications. There's counseling that you can get from your physicians. There's the Iowa Quit line that has great suggestions and counselors that you can talk to. Don't smoke. And don't start smoking if you're not a smoker. So just other general heart considerations to help your heart health. Get good sleep. If you're not sleeping well, definitely get that addressed with your physician. Figure out ways you can improve your sleep. Maybe you have sleep apnea, or you are treated for sleep apnea, but it's not working. Do your best to keep finding those different options. But you want to keep working with your physicians to help you get good sleep if you're not getting good sleep. Get regular physicals. It's amazing how often things are caught just on a regular physical. And it's awfully hard to treat people if you don't know what their baseline is. So make sure you get your regular physical so that we can help treat you best when something is wrong, when something changes. See your dentist. Your poor dental health can be linked to heart infections and heart health. Get your vision checked. If you're on different heart medications, they can affect your vision, or a problem with your vision can tell us there's a different problem. And make sure you communicate effectively with your healthcare providers. If you have any concerns, any worries, make sure you write those down. I'm always a huge advocate saying write down what your concerns are, because it's so easy to forget that you had that one little mole that you wanted them to look at but I wrote it down 6 months ago. So it's so easy to forget those little things that you wanted to talk to your doctor about. So make sure you write those things down, write a list, talk to your physician. And this is my new plug for everybody. If you set up your voicemail on your phone. Most people screen their phone calls, but if it's important, they'll leave a message. Well, yes, but if your voicemail box is full, I can't leave a message. So make sure you clean out your voicemail box. Make sure you have it set up, and anytime you're seeing any healthcare provider, ask questions, make them clarify if you don't understand what they're talking about, and then know your medicines. Keep an updated list with you or access to it, whether that's on your phone or through MyChart, something like that, but keep a list with you. So my overall summary, I think most of us knew it. You just have to execute it. Move your body, eat healthy, protect your mental health, and practice good health maintenance. That's all I've got. So what are your questions? Does anybody have anything? Oh, sorry, I kind of interrupted that.
Thank you, Carrie.
Sure.
I'm going to turn on the microphone so we can have a couple of questions here. Okay, does anybody have a question? I'll come up to you. I'm getting my exercise in for the day. Here we go.
I'm wondering about cardiovascular exercise. Say you're walking on a treadmill or something, what should you be shooting for a specific heart rate or specific speed or time?
Sure, that's a great question, and that's something. If you're taking heart medicine, it can impact your heart rate, and so heart rate is not typically a great way to say how hard you're working because it can be so variable. When we're talking about like competitive athletes, you might have heart ranges and heart zones that you're keeping your heart rate at, but really the best way that I tell people to decide if they're working hard enough is that talk test that I had mentioned earlier. Can you still talk while you're walking? And if you can still talk, you're at that moderate exercise. If you're getting to the point where you can't talk as much, you're getting more of an intense exercise. But I don't typically give out the a heart rate range just because it's so variable and so many other health considerations that go along with that. So sorry, that might not be the answer you're looking for.
Well, no, it's okay. I have one more quick question, though.
Yes.
I've been seeing all these ads on TV about something called Super Beets.
Oh.
Is this a magic vegetable?
Beets are very good for you. Yeah, I like beets. To say that there's any magic bullet, I kind of shy away from all of that and say I'd rather see you get your nutrition through real food as opposed to supplements. I don't know a whole lot about real beets. I have heard of people that take it. I don't know that it's harmful, but I definitely shy away from recommending supplements. Something that you could definitely talk to your doctor about, or even a dietitian. You can talk to them about it. They might have a better answer for you. But I prefer people get their nutrition and their energy from just eating beets.
Any other questions?
I have just two quick questions.
Yes.
I think you answered one of them already. What about vitamins and omega-3 fish oils? Have you got an opinion on those for heart health? And
Sure.
the last is, you mentioned effective relaxation techniques, yoga and Tai Chi. I have no balance or a balance problem. Is the meditation, which I haven't done any research on, is that as effective or?
Yeah, meditation would not have the cardiovascular effects as like yoga or Tai Chi, because it's really just kind of sitting and focusing, and a lot of times it's some imagery or maybe prayer. But yeah, you're right. Yoga and Tai Chi do take a fair amount of balance. There are lots of like chair options to do yoga or even Tai Chi. There's lots of variations that you can do of that, because you're right, that can be a huge challenge when your balance isn't great. But which brings up another fact that any exercise that you can do, even if it's chair exercise, any strengthening that you can do is going to help improve your balance. And that is a very important piece of your health and staying healthy as an older adult too. So I would encourage you to try like the maybe this if you're worried about balance or falling, trying like the chair yoga or chair Tai Chi. There's if you're somebody who likes to go online, there are tons of free videos that you can get on YouTube that are maybe even like 10-minute easy yoga, 10-minute chair yoga, different things like that, and you can try different things like that. There's also lots of videos like DVDs that I've seen. I've even seen some at the library that are exercise videos that you can try different versions of. I have even a Tai Chi video that has different levels of abilities in cardiac rehab that we loan out to people too. So it's worth checking out, and those really are helpful when it comes to breathing, stress management, and then the added exercise benefit on top of it. And then your first question, going back to supplements, fish oil, that kind of thing, it's a little bit variable per person. A lot of people take a multivitamin. It's it's certainly not going to hurt anything. If you have something you're concerned about, I would definitely go through your physician first. Fish oil, there hasn't been more recent research hasn't really supported the fish oil argument as much. I think a lot of people were taking it, and then it kind of went away because the research showed it wasn't making as much of an improvement as they had initially thought. A lot of people still take it. They feel like it helps. It's not hurting anything. I guess it can be. Some people might have more like reflux or acid when they take fish oil. So if that's an issue for you, you might want to stay away from the fish oil. I actually do take fish oil myself, but it's because I have dry eyes, and it actually helps my eyes. My Dr. Scallon told me to do that. So. So it's for a completely different reason. But I wouldn't say I wouldn't be concerned as much about taking the fish oil. It'd be okay for you to do it if you like it. But as far as the heart benefits, it's not showing us as great of improvements as they had initially thought.
Okay, we'll take another question from the crowd, and then we'll look online to see if there are some questions, and we'll come back and to the crowd, okay?
Well, there's another oil that's like omega-3, 6, and 9, vegetable-based, I guess, not fish oil.
Okay.
Is there any advantage to that?
It would be along the same lines as fish oil, but it'd be kind of the same thing, like the same benefit that they were looking for with fish oil. And so the intent with fish oil was or the omega-3 fatty acids, that type of food, whether coming from a vegetable source too. The idea is that it was going to raise your good cholesterol and help reduce the bad cholesterol. The research wasn't showing that was helping all that much, as much as people had hoped. Again, it's not a harmful or terrible thing to take, but I don't know that there's a whole lot of benefit with it.
I took a statin drug for a while that the doctor said I should take, but pretty soon I couldn't lift one leg in front of the other one hardly.
Yeah.
And I got disgusted and quit.
Yeah. So... Yeah, the statins can definitely come along with some side effects. And someone who has a diagnosis of coronary artery disease, you definitely want to do your best to try and keep your cholesterol levels down. The statins, though, there's several medicines that are in that category, and I've seen people have severe reactions like what you just described, and then they switch to a different statin, and they do fine with that. They don't have those side effects and still have the benefit of their cholesterol levels coming down. So it would be worth having a conversation with your doctor about switching to a different one. There are people who can't tolerate them across the board, and then they end up taking a completely different kind of cholesterol medicine, there's newer cholesterol medicines that are injectable. They're new and very expensive. And so just like many drugs across the board, you have to try these other ones before you're qualified to take this newer version. So, but my suggestion would be to talk to your doctor about trying a different statin and see if your cholesterol levels are a concern.
Cholesterol levels down to what?
That's a good question. I've got I knew, I even brought a paper because I knew somebody would ask me that. Okay, so when, let's see, I'm getting in the right spot here. So the goal for your LDL cholesterol is to keep it under 70, less than 70. That's the bad cholesterol. You want to keep that as low as possible. You want your triglyceride levels to be under 150. If this is, I'm sorry, I should have, if you actually have a diagnosis of coronary artery disease, you want to keep those low levels, the triglycerides under 150, the LDLs under 70, the HDLs, they want it as high as you can get it. The total cholesterol under 150. If you do not have a diagnosis of coronary artery disease, let's see, Sorry, that took me too long to find that. So the optimal guidelines keep that LDL less than 100. So 70 if you have coronary artery disease, but keep it under 100 if you do not. Does that help?
Oh, I think so. I don't know. Whatever number I've got, it's like 240 for total or whatever it is.
Okay.
And it's been that way for at least 40 years. And the old guy that looked at me once, and when I was young and he was old, he said, "Oh, you're running a click, Rich. We're more worried about the guy that's up around 1,000 or whatever." He didn't care. And now the new guys, we got this medicine. So all of a sudden, oh man, you got to do something. But I don't have. Perhaps would you recommend going to the Rocky Mountains or the Sierras every year and hiking around at about
Definitely.
8,000 feet?
Yes.
Okay, excellent. I'll do that anyway, for sure.
Okay, we'll check online to see if we have any questions, and I'll bring it back to the audience, okay? Tim, are you seeing any questions coming online? Okay. Does this keep out of this slide?
Sure. Yeah. Wasn't sure how to look at
No questions in the chat.
No questions in the chat. Does anybody else have a question in the audience? Okay.
I have a comment for the gentleman that mentioned the cholesterol. I had the same thing you did. They changed the rules. Normal was 250, then they dropped it to 200, and I suddenly had a problem. And mine, you said 240, mine's 220.
I'll go right up here and then I'll come back.
What about CoQ10?
kind of same thing. It feels like everybody was getting that for a while, and then they went backwards with it and not recommending it as much anymore. So that evidence just wasn't showing that it made a significant difference in the coronary health. So again, not something that's terrible, but I believe it's kind of expensive. So something to reconsider if you're on it, whether or not you need to be.
Quick question on nuts and legumes. Are all nuts good? I mean, I like cashews. I'm not too wild about almonds.
Sure, yeah, and each all nuts kind of have slightly different benefits, but yeah, nuts in general are good. Of course, you want to avoid the ones that are salted or flavored. The raw nuts are better, but yeah, any of them would be great. Yeah.
Any more questions? Okay.
Thank you. I like, what about caffeine? I like my 2 cups of coffee in the morning, but I have to kind of behave myself after that. But
Sure. Yeah, I'm good with 2 cups of coffee as long as your cups aren't this big. So, that's like the 1 glass of wine, but just, but 2 cups, they usually, the American Heart Association, 2 cups of coffee, they say is okay. The biggest concern with caffeine is that it can impact your heart rhythm. It can create skipped beats or fast beats, early beats, that kind of thing. But different people are more sensitive to it than others. So some people, it's more of an issue than others. If you're 2 cups of coffee, you feel good, you're not having palpitations, you're not having trouble, you're otherwise drinking enough water, enjoy.
I stay away from, I drink it at home. I don't drink it at Starbucks or something.
Well, yeah, that's true. I can tell a big difference if I have a Starbucks cup of coffee. Yeah, about jump out of my skin.
And you already answered this, I think, but I see advertisements about balance of nature, vitamins, fruit and vegetables and everything, but you're kind of still with eat healthy. Yeah.
Getting your nutrients from real food is definitely the best option. For whatever reason, if you can't and you need to do a supplement instead, by all means, second best. Do what you can do. I would definitely review them with your doctor, especially if you take a lot of supplements or a lot of vitamins, and make sure that you are not getting too much of one thing, and that you're kind of covering all of your bases. But ideally, getting your nutrients from food is by far preferred.
Okay, thank you.
Okay, we have one more question.
This is just a comment. I have osteoporosis and really need to do exercises. Does everybody? Something I found really enjoyable is aqua aerobics. Ames no longer has an indoor, I might call it slightly warm water pool. And so if the chance comes up for us to vote for that again, that would be something that our community could really benefit from. It's nice to be active and not to be afraid of falling. And so I really like that.
Yeah, great point. Yeah, and I didn't mention aqua aerobics or water exercises, but yeah, absolutely a great way to get exercise, especially for people who have like any, just concerns about falling, but then also bone and joint problems. That weight bearing exercise does not feel good. It's too painful. If you get in the water, you can still get really good exercise. Yeah, Ames definitely suffers from a lack of options right now. So thank you for that point.
We have time for more questions if anyone else wants to raise their hand. Okay.
Well, thank you.
Thank you, Carrie. Thank you for your time in preparing and presenting this program for us today. I would like to remind everyone of our upcoming Primetime Alive programs. The next one coming up on February 15th at 2 o'clock here in the auditorium is Putting Out the Fire, Prevention and Treatment of Gastroesophageal Reflux Disease, otherwise known as GERD. Then coming up on March 1st, The Importance of Posture with Aging at 2 o'clock, also here in the auditorium. And on March 9th at 2 o'clock, Staying Independent and Knowing Your Options, also in the auditorium. Once again, thank you for joining us today and have a wonderful day.